Hi, my name is Dr. John Vizzuso. In 2015, I got my doctorate degree in business administration, and a wise professor told me, get your degree and change the world later. Well, I'm here to tell you, Human Assets is here to change the world. We're here to make a difference for you, your employees, through coaching, through education, through interventions. This organization is here to make a difference, engaging one person at a time. So the first lever of engagement is personal commitment. It's a choice. Your employees, your stakeholders have to have a psychological ownership and emotional connection into the organization. They have to have that personal commitment. You cannot make them have it. It's a personal choice. Second is expectation realization. Meeting expectations is critically important, and they're bidirectional. So I have expectations of my boss has expectations of me. They have to be reasonable and understandable and can change, but it's really important to meet those expectations. If you meet those expectations, it builds trust. And trust is like the circulatory system of engagement. It's the bond that keeps everything together. And lastly, it's the emotional power index from the very top of the organization to the very bottom. The more vertical that distance is, the more likely that you'll have disengagement issues because the top doesn't understand the expectations of the bottom. The more horizontal, the more engagement you'll have. Those are the four levers. Repair Me is a coaching practice that takes Gestalt coaching principles in both individual and group sessions, and it teaches people how to self-reflect. It teaches people how to modify their behaviors, to stop telling themselves lies, and to improve their stress and burnout in their workplace. Prior to the pandemic, burnout was pretty prevalent in healthcare. And watching on TV the pandemic does not give it justice. Burnout has turned into moral injury in healthcare. Symptoms of depression, emotional breakdowns, lack of sleep, lack of continuity, issues at home. They're all symptoms of what's happening in healthcare today. To repair burnout, you first have to diagnose it. And you do that by asking powerful questions, crucial conversations, and really seeing where someone is at from an emotional perspective. Then you get them into coaching. Group coaching will allow them the opportunity to learn how to coach and also be coached by other members that are having the same issues. And ultimately, it heals itself. I developed Human Assets because over the last 32 years, I've seen really bad leadership. And Human Assets are so important to the mission of the organization. And I wanted to be able to engage one person at a time. Employee engagement issues really come out in poor performance of the organization, poor quality services or products, poor customer satisfaction, and also poor employee satisfaction. If you have high turnover rates, more than likely you have engagement issues in your organization. A coaching circle is where you take 5 or 10 people into a group session where you start to learn coaching methodologies so that you can coach each other and coach your peers back in your workplace. You learn how to be an effective coach. Some would say physicians aren't coachable. They have a high degree of intelligence with low emotional intelligence, but I don't believe that. I think if you use coaching on call, where you provide them a lifeline when they have confidence dealing with conflict, that's where you coach physicians. At a very young age, I just love helping people. Right out of high school, I became a radiology technologist and was in the care setting. I soon, at a very young age, opened my own business doing mobile imaging, and then since then have been executive level in hospitals and physician practices. Engagement is so important to me. Sometimes for me as a small business owner was the difference between success and failure. And I think as an industry, we can teach our leaders to effectively influence engagement in the work setting. And I want to do that by engaging one person at a time. The segmentations of engagement in every organization, there's a segmentation. You have a portion of the employees that are engaged. Those are the ones that when you need something done, it's crunch time, you go to those employees. Then there's the middle bunch that it depends who they work with. If they work with engaged employees, they become engaged. If they work with disengaged employees, they become disengaged. Then you have the disengaged. Now, some disengaged probably function just fine. They just don't want to be called after work. They're not emotionally connected, but they do a decent job. And then you have the ones that hate everybody around them and everything they do, and they actively do things against the mission of their organization. That's the segmentation of engagement.